Hello everyone, thank you for watching our presentation as part of the Ask About Asthma campaign on our project on safety and sustainability of salbutamol, with a focus on advice and use after discharge of the wheezy child at the Great North Children's Hospital.
Our video has been made as part of the Ask About Asthma campaign.
I'm Dr. Emma Vittery, Clinical Sustainability Fellow in Paediatrics at the Great North Children's Hospital and with the Centre for Sustainable Healthcare.
I'm Dr. Charlie Verity, a GP registrar currently working in paediatrics at the Great North Children's Hospital. And this is Rachel Morris, Children's Asthma Specialist Nurse.
We have been undertaking a project speaking to staff and families about advice and subsequent use of reliever inhalers when a child is discharged from hospital after an attendance with acute wheeze, and that includes viral-induced wheeze or a diagnosis of asthma. So what has environmental sustainability got to do with inhalers? Well, metered-dose inhalers contain hydrofluorocarbon. That's a powerful greenhouse gas thousands of times more potent than carbon dioxide. In order to reduce the impact of this, we need to reduce overuse of salbutamol, ensure patients aren't using empty inhalers or throwing away non-empty ones, and ensure correct disposal to pharmacy. And the first 2 points clearly have important safety implications as well as sustainability.
When discharged, we should be advising families to only use the blue inhaler as needed based on symptoms. This approach has been shown to be safe and also uses less salbutamol, which is better for patients and planet. We should also be advising families how to correctly dispose of inhalers and how to tell when an inhaler is empty.
What we found from speaking to staff. Only one member of staff surveyed knew how to correctly tell when an inhaler is empty, and only 7 staff knew how to correctly dispose of an inhaler. Almost half of nurses know to advise patients to use their reliever inhalers only as needed, as opposed to less than a quarter of medics.
The main barriers that staff identified were time pressures, lack of knowledge and training on the issue, fear of giving information overload to families, and assuming that these discussions were already done by nursing staff, pharmacists, or primary care.
What we found from speaking to families. Almost 1 in 5 patients were not informed to use a symptom-based management plan, i.e. an as-needed approach when discharged with their reliever inhaler versus a traditional weaning plan. 13% of patients knew how to correctly dispose of their inhalers, and only 1 patient we spoke to was informed of how to correctly tell if their inhaler is empty. So far as part of this project, we've delivered a number of education sessions for medics and nurses on these topics. We've also incorporated correct disposal of inhalers and how to know when your inhaler is empty into our specialist nurse-led asthma reviews. We're also reviewing a standard paragraph to be included in discharge letters to go to families and primary care, and we plan to survey and also deliver education sessions to pharmacists.
Our key messages are to make sure that families know how to correctly tell when an inhaler is empty, to make sure that families know to return empty inhalers to the pharmacy, and to discharge patients with a symptom-based management plan, that is, advise them to use their reliever inhaler as needed based on symptoms. There's loads of fantastic written resources available on Beat Asthma.
However, do keep in mind accessibility of information and barriers to written information, such as visual impairment, literacy levels, and language barriers.